Dry socket, also known as alveolar osteitis or localized osteitis. It is due to loss of blood clot. According to Nitschin's theory, the organism responsible for dry socket is Treponema pallidum. Pain usually appears 3 days after extraction. Most common site lower molar due to less blood supply. Treatment modality is placing sedative dressing like zinc oxydigenol, etc. Now we'll discuss about the displacement of different fracture segments and direction of displacements and muscle involved. If there is bilateral fracture of the mandible in the canine region, the direction of displacement will be anterior segment is displaced backward. The muscles involved are geniohyoid, genioglossus, anterior belly of digastric. This fracture remove the attachment of tongue to the mandible and allow the tongue to fall back. So this is in case of bilateral fracture of the mandible in the canine region. If there is bilateral fracture of mandible in the molar region, then the direction of displacement will be anterior segment is displaced backward and downwards, and muscle involved digastric and mylohyoid. In case of subcondylar fracture, the direction of displacement will be condyle is displaced anteromedially and the muscle responsible for that movement or displacement is lateral pterygoid. If there is fracture in the line midline of mandible, there will be minimum displacement. Now fracture lateral to the midline in the incisor area of the mandible. The direction of displacement will be fragment with genial tubercles is displaced lingually and muscles involved are geniohyoid, mylohyoid. Now I'll discuss about the composition of obturating materials for primary teeth. The most common obturating material for primary teeth is zinc oxydigenol. There are several other obturating materials are used. The composition is very important, like Wakop's paste. The compositions are parachlorophenyl camphor, KRI paste. This is very important, and the compositions are iodoform, camphor, parachlorophenyl menthol, maize to paste, zinc oxide, iodoform, thymol, chlorophenyl, camphor, and lanolin. The Vitafix, calcium hydroxide, iodoform, oily additives. One MCQ will may arise from this topic. What is the most common obturating material for primary teeth? The answer will be zinc oxydigenol. The most cardiac toxic local anesthetic is bupivacaine. The last resort of local anesthesia is pulpal anesthesia. Cocaine has vasoconstriction property. Local anesthetic technique for hemophilia is intraligamentary. And in case of hemophilia, nerve block is contraindicated. And in case of bilateral inferior alveolar nerve block, this is not contraindicated. Don't get confused. I'm talking about hemophilia. In case of hemophilia, nerve block is contraindicated due to bleeding, massive uncountable bleeding. And the local anesthetic technique that is used for hemophilia is intraligamentary. And the separate question is, a bilateral inferior alveolar nerve block is not contraindicated, but we rarely use bilateral inferior alveolar nerve block when you need inevitable bilateral surgery involved soft tissue, tooth, bone bilaterally, then only we use this bilateral inferior nerve block. Otherwise, we don't use, but it is not contraindicated. The methemoglobinemia is common complication of pilocaine. Now I'll discuss about important oral manifestation of different vitamin deficiency. The terminology is important. I'll come later. Vitamin A deficiency. The characteristic features in oral epithelium is hyperkeratosis of oral epithelium, decreased salivary flow, and dryness of mouth. Vitamin B1, a thiamine deficiency. It leads to edema of tongue, loss of papillae, pain, and paresthesia. And niacin deficiency, sandwich walled tongue. This terminology is important. here what happened? Depapulated red blood, appearance of tongue. Now, vitamin B2 or riboflavin deficiency, magenta glossitis. It is characterized by cyanotic appearance of tongue, erythematous cyanotic appearance. And the particular term for vitamin B12 deficiency or riboflavin is magenta glossitis. And vitamin B12 deficiency, it is leafy red tongue, raw red bloody tongue. So the terminology beefy red tongue associated with vitamin B12. A tooth will translate when its center of rotation is at infinity. During controlled orthodontic tipping, the center of rotation lies at tip of the root. During torque, center of rotation lies at the bracket. The center of rotation for simple tipping lies at the 1/3 of root length from the apex. Intrusion and extrusion, the center of rotation will be outside the mouth. So one thing to remember, that in case of controlled tipping, the center of rotation lies at the tip of the root, and in case of uncontrolled tipping, or simple tipping, the center of rotation will be 1/3 the root length from the apex. Now, gingivitis is at its peak in children at age 11 to 13 years. Lethal to Actinobacillus actinomycetum vomitans is S. sanguis. Porphyromonas gingivalis growth factor. Succinate from Capnocytophaga ochraceus. A 3-fiber periodontal fiber, their function is very important. Alveolar crest periodontal fiber, it prevents extrusion of the tooth and resists lateral movement. In case of oblique fiber, it resists vertical masticatory forces, and apical fiber, it resists rotation of teeth. Now, different type of teeth injury and the splinting time. In case of subluxation, extrusion 2 weeks. In case of lateral luxation or intrusion 4 weeks. Avulsion 7 to 10 weeks, 7 to 10 days, or 1 to 2 weeks, you can say avulsion. Root fracture 4 weeks, alveolar fracture 4 weeks, and lateral laxation 8 weeks. So maximum splinting time required for lateral laxation and minimum for avulsion. This chart is very important. You should remember this chart. Now next is force of tooth movement. Tipping, that is the most common tooth movement is tipping, 35 to 60 gram. Bodily movement 70 to 120 gram. Root uprighting or torque 50 to 100 gram. Rotation 35 to 60 gram. Extrusion, this movement is the most easiest, 35 to 60 gram. And intrusion, you will need least force, that is 10 to 20 gram. So if question asks that what is the common tooth movement, that is tipping. In case of bodily movement, torque, rotation, extrusion, intrusion, some amount of tipping will be there, and the most easiest tooth movement is extrusion, and least force required in intrusion, that is 10 to 20 gram, and maximum force required for bodily movement, that is 70 to 120 gram. The ideal crown tooth ratio of an abutment is 1:2, and the optimum crown tooth ratio of an abutment is 2:3, and the minimal is 1:1. In Anti's law, the ideal ratio is 2:1. Now this point is very important. The position of key and keyway of non-rigid connector of wire abutment. The keyway is placed on the distal side of the wire abutment. Keyway is the female part that will be placed on the distal side of wire abutment. So the key or male part will be placed on the mesial side of the distal pontic. The implant should be positioned at least 1:5 mm away from natural teeth. So one natural teeth and implant, the distance should be 1:5 mm, and the distance between two adjacent implants is more, that should be 3 mm. And the masticated loads, natural teeth 44 pound or 20 kg, and in complete denture the force will be, the masticated load will be average 13 to 16 pound or 6 to 8 kg. Fracture of denture at midline, the reason is excessive resorption of alveolar ridges, and the fracture of the denture at midline, it occurs particularly in the maxillary denture. Now denture stomatitis, the classification is very important. Newton's classifications: type 1 is localized inflammation or pinpoint hyperemia, type 2 is generalized inflammation with diffuse erythema, and type 3 is granular type. Now the emergency retentive force of a complete denture is atmospheric pressure. This is my last slide. Major connector of RPD. The least rigid major connector is horseshoe or U-shaped major connector. Most rigid is antero-posterior bar. Least support single palatal bar major connector. Best support antero-posterior strap or closed horseshoe-shaped major connector. And the maximum retention is complete palate major connector. Thank you very much for patient listening. See you in next video.